Oh.
Oh.
Ah.
Oh.
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 Oh. Welcome to the office.
My right shoulder hurts right in the
If
middle.
you sleep on your right shoulder.
Yeah, it hurts right in the middle. And it goes up into my neck and slightly feels like a nerve issue.
So the neck is designed to have a forward curve.
Yeah.
Your discs are still good there, Emma, all good there, but we can see that there's a slight reversal going on right here. Yes?
Yes.
Now here's the answer.
Oh, gosh.
Inflection. 2 move forward, 3 move forward, 4 moved, 5 moved, 6 moved, 7 did not move. It's still tilting.
Oh.
That's your answer. So when you go forward, they all move forward.
Mm-hmm.
When you go back, they all move back.
Mm.
In yours, when you're going forward, this one is still stuck back. And this 7, this goes to the rotator cuff as well.
Okay.
Does that make sense?
That makes perfect sense.
Okay. C7. You ready now?
We'll see.
C7. C7. Hi. You good?
Mm-hmm.
Okay. I have permission?
Yes. Oh.
Gotcha.
That was a lot, right?
Yep. A little bit more, okay?
Yeah.
One more.
Oh, really? Okay.
Right side. Light, light, light. No. Drop. There.
Mm-hmm.
That's it. Oh, look at that. Sit up straight. Check it out.
Wow.
Check it out.
Oh my gosh.
Yeah.
Oh my gosh.
Right?
It's even more than that one. Wow.
Bueno. Good.
It's so amazing.
Awesome.
Wow.
I'll go over your x-rays. I'll explain what I see. After that, we'll do the exam.
Okay.
We'll figure out where we're going to start today. Sound good?
Yes, thank you.
You didn't have a whiplash, you're telling me, right?
No.
Okay. So what happened at this part of the spine? It's kinking forward.
Right.
It's compensating. So I'm pretty sure you get pops and cracks and that tightness in the middle of your neck.
Mm-hmm.
That's where that's coming from. Okay, so the take-home message here is this upper neck is compensating because of the posture. In extension, you see how they all line up?
Yes.
That's how they should be in neutral.
Oh.
Okay? Now, here's our answer. In flexion, they should all move forward, yes?
Yes.
2 move, 3 move, 4 move, 5, 6 kinda, 7 didn't move, did it?
No.
7's still stuck back.
Mm-hmm.
Maybe T1. So 7 T1 is a potential, the base of your neck. So she's compensating by more movement, hypermobility in the upper neck. That's why you're getting this tightness right here. You feel that?
Mm-hmm.
But it's not moving down here. But it looks like it's moving because it's compensating up top. Do you feel what I'm doing here?
Yes. Yes.
Yes. Okay, I don't want to go harder than that. You ready?
Yeah.
Let's do it.
Okay.
C7 we're going to set as a PLS right on the left side. Hands on your lap. Good. Left ear down. You are super flexible. So with that is we have to stabilize with the stabilization hand and follow it through. Left ear down. Gotcha. Home run. Hi.
Hi.
How's it going?
It's
Raise
good.
your right hand. Walk it up. Good stuff.
I feel different. I don't know how to describe, but it's different.
Hopefully different good.
Different light.
Different light. Welcome to the office.
Thank you.
You're coming from where, madam?
I came from Saudi Arabia.
Starting at the base of the neck. C7, C7, C7. C7, left, chin down, down, look down. Don't help too much, okay? Just a little bit. And it's very light, and you're flipping that switch on. Flip on that light switch. Look up and flip it. Perfect. Hi. Walk it off, please. Ah. Very nice. Very good, madam. Nice to meet you.
Nice to meet you too. I think I also have issues with my posture, up here. Sometimes when I sit, I do that turtle, that turtleneck position. And my mom always gives me smack for that. And I notice that I do that a lot. Maybe it affects the way I sit. I need to change that too, I guess.
We're going to talk about all that. And I think when I go over your x-rays, things will make a lot of sense as to what's going on. So in your neck, your discs are good, but this C2 is off. You can see it's a little thin in the back here. If I go through flexion extension, this is your neutral. In extension, they should all go back. You don't have a lot of extension in your neck. It looks like your muscles or the tissues bulge in the back, making it look like you have extension, but that's the tissues, but the bones need to move more. Yeah. In flexion, here's our answer now, okay? So in flexion, they should all move forward. C2 didn't move forward. 3, 4, 5, C6 didn't move forward. So you have both going on, 2 and 6. We will decide which one we will start on. I will not do 6 and 2 together on the first visit. Yeah. Okay? That's too much. But we'll do a test to determine which one. Make sense?
Yeah, that makes sense.
Starting at the base of the neck. Head down, please. And the first thing we're getting is 15 points. C7, C6, C7. Next thing we're getting, 10 points, C2. And I'm just checking general movement, okay? 6, 5, 4, 3, 2, tender. Bend left, let me have it please, let me have it. Passive motion, let me have it. Oh yeah. We'll do divorce test. Divorce test will help us determine if we're going to adjust the upper or lower cervical spine. Looking up, isolating the lower cervical, turn left. Is it tight or you're just resisting me?
No, I was actually going with it. Okay. I wasn't resisting.
Good. There. It's tight, but the movement is still there. Down. That doesn't move as well. Oh, C2. Okay, let's start with your neck. Sit back for me, please. Okay, we're going to do C2 as a PL. Yeah. We're on the spinous of 2 right there, okay? You feel the tip of my finger.
Yeah, I feel that.
I'm going to lighten up a little bit, and I need to drop that left elbow down. Look up.
Oh,
Gotcha.
Okay.
Nice. Walk it off once, please.
Just
You okay?
Yeah. It was loud, but that was at least it didn't hurt.
Well, it doesn't hurt. You know, people say, is it gonna hurt? It's gonna be, sometimes it's spicy.
Yeah.
And as you know, spicy means what?
Flavor.
A little bite to it, right?
Yeah,
sometimes.
Don't mind.
Reza.
Hey.
Nice to meet you.
Nice
Welcome to the office.
Thank you so much for having me.
Thank you. How can I help you?
Oh, well, almost 2 years ago I did something very stupid. I asked someone to walk on my back. I had some spasms. That person lost his balance on my C7 and T1. And immediately after that, I couldn't breathe.
You have a good curve here. Something is going on around C3 though. This is extension. You don't have a lot of extension in your neck.
And also my levator scapulae is in constant spasm.
Okay.
On the left side.
And what nerve controls that?
I forgot the name, but the dorsal scapular.
C5, C6, yeah.
Yeah.
Yep, exactly. Now, and when we're looking, you can see, here's the thing that happens to you in flexion. Your whole spine should move forward. You're only moving up top here. And I want you to see, this is the culprit right here.
Yeah.
This is still binding here. Do you see how these are still together? This one opened up.
This
These
is C7?
This is 2, 3, 4, 5, 6, 6.
6 and 7.
So I see 6 and 7 starting at the base. And the first thing we're getting, oh wow, interesting. Okay, so we're starting at the base. It looks like it's going to be at C6, C7. It's not. Oh, it's starting up top here. C1. 9 points up top. So we have the base here, T1, C7, C6, C5, C4, C3, C2. C2 is wedged on the left, C1 is wedged on the right. So what we're going to do, as we said, we're going to do the critical atlas, and your critical atlas, you have the atlas wedged on the right, but we have C2 on the left. So let's start with C2. So because I'm adjusting C2 left, we're putting the strap higher on the opposite side. We get a better stabilization, guys. C2, hands on your lap, please. Good. There you go. Try not to help, okay? Look up. Gotcha. Nice. Right hand up now. Now I'm taking the stabilization opposite for his atlas. C1. C1, we're going to set it as an ASRP, so it's come this way, right. I need to turn the head away this way and set through, okay? Down, RP, so turn away. Gotcha. Nice.
That was so precise. I felt it.
Yalla, walk. Imshi. Let me rescope you. Let's see what we got. Starting at the base of the neck. Neck is clear. Hey, Emma!
Hi!
How's it going?
Good! I'm so much better.
What do you mean so much better?
I can't wait to tell you.
I want to hear all about it.
My shoulder was the physical ailment, is that the right word, that gave me the most physical pain during my days for the last 6 months.
Okay.
And I was without knowing it, like kind of convinced that pain wouldn't go away, but it did by a huge amount, like at least 50%.
Okay.
And I was really shocked by that.
After our first visit.
After our first visit. Like I
Okay.
really thought this is such a vigorous and stubborn injury that I just thought that it would take a really long time for me to see even any difference there, and it just at least by 50%.
Definitely better.
Mm-hmm.
So first visit, this is fine.
Mm-hmm.
The right shoulder was very ratchety when we were moving it. It's a little bit better, a little bit still there though. You ready?
Yeah.
C7. C7. Nice and easy there. Da-da-da-da. We want to lift. There it is. Gotcha. Tiny bit more on that right side if you don't mind, okay? Tiny bit. There you go. Right ear down. Gotcha. She is quick. Walk it off, please. Hi. Hi,
Huh?
welcome to the office.
Thank you.
Tell me, how can I help you?
It's been chronic pain and discomfort throughout the neck shoulder area.
So when we're looking at the neck, what are we seeing? We're actually starting to see a slight reversal here. I know you get pops and cracks in your neck. You can see the edges here wearing out a little bit. That was an old whiplash injury. Okay. Now I can see C6 is slightly swollen. I can see C3 is slightly swollen. This is you going in extension. You don't have a lot of movement going back. This is you in flexion, and this is where we get our answer. When we look here, C2 move forward, 3, 4, 5. C6 did not move. You see how it's still kind of tilting back? 6 is clear. Atlas showed up. Crazy. Okay. So we're going to be doing the top one. Okay?
Okay.
C1. Nice and easy there. Good. Nice and easy there. Good.
Oh.
Hold on. Nice. Sit up straight for me. You okay?
Yeah.
Look straight ahead. Turn to the left. Turn to the right. Look straight ahead. Look up. Up and to the left. Up and to the right. Look straight ahead. Look down. Down and left. Down and right. Good. All clear. Welcome to the office, Larry.
Thank you. It just feels weaker when I look down. It just kind of like it's pinching something or something.
Are you getting weakness or numbness or tingling in your hands when you look down?
No, those are kind of all the time. It's been that way for a long
Okay,
time.
sit up straight.
Yeah.
Now, tell me as you're looking down when you start to feel that. How far down?
Right about there. Just I can feel it just kind of
From up
lose a little bit
here?
of power. Yeah, it's just like going not all the way. It's not shutting up. I can feel it kind of draining power when I look down.
Okay, so this is important, guys, and this is also a good test, simple functional test.
Yeah.
After, at the end of the visit, we're going to redo that and you'll tell us if anything's different.
Okay.
Fair enough?
Yeah.
Okay.
Oh, when I turn my neck to the right, I can't turn it far to the right. I'm good left, but I can't go to the right.
Okay. As we're getting to the neck, guys, okay, this is kind of important now. You can see he's got some hardware in there. He had a pretty traumatic accident.
Yeah.
And this is another first for me, guys. So I have people that have 1, 2, 3, where 2 vertebrae are connected. In a way, it was a good thing the way they did this, because if they would have fused the whole thing together,
I lost mobility.
you would have lost a lot. Okay. Thanks, they did their job. They saved you. Okay. If we need to work on this one, I'm okay with that. If I need to work on that one, that's going to be pretty gangsta. So the idea with pressure, right, and what we're doing here as well, we're looking for the nerve pressure. Now, the fact that these have fused together, they fused that, right? They put them together. They filled it up with whatever, the nerves. See, you can see the nerve holes. Like up here, there's a lot of rotation in his neck. His discs are still good. 2, 3, 4 disc is not there. 5 is there. 6 is not there. 7 is there. Okay, so we can deal with 7. I can deal with 2 and 3. I hope there's nothing here, and the reason why is this is there.
Got a little nub on that. That's the nub.
That's the nub. But again, it is what it is. Wherever the pressure is, that's our job, to clear nerve pressure. That's extension. That's flexion. And we're probably going to be working on the base. So I'm okay working on the base of the neck. I'm okay working on the upper cervical in the neck. Starting at the base of the neck, head down, please. And the first thing we're getting is 15, 20 points. He's 71. All right, 23, 24 points. 15 points, right side, up top. Oh, you talking about that movement?
Yeah, I'm going to the right. It's really stiff going to the right.
Well, that's coming from a lot of this stuff up here.
Probably just my accident. I don't know.
That's the scar tissue. A common question I get a lot is, can you adjust someone after surgery with hardware in their body? And the answer is yes. And I'm going to show you today. Oh, interesting. That's what threw me off. Okay. So he actually has cervical ribs. 70% of the vertebral prominences is C7. Yours is T1. Okay. Relax there, please. Let me do the work now. Try not to help too much. Feet out, resting on your heels. Good. T1. T1. So we need to stabilize nice and firm. And we're setting up. You got to drop. Let it go. Gotcha.
There, that was it.
Wow. Walk it off, sir. Good stuff. Have a seat, please. And let's recheck. Neck is clear. Can we test something out? Do you remember when you looked down?
Oh yeah. Yeah, it doesn't get numb no more.
A little different, right?
Wow. Yeah.
Cool.
Yeah, it's gone. Wow.
Nice to meet you guys. You're coming from India?
Yes.
So the main reason for us coming here is she suffers from headache, a lot of headache. She has neck pain.
Okay. Even the neck is really good. I'm impressed with the neck. I see this one going on. I expected your neck to be worse.
Okay.
I really did. I expected your neck to be worse. So forward flexion, this is the one here that didn't move. This one didn't move also, but we're down here at C6. C2, 3, 4, 5, 6. C6. So first thing we're getting is 14 points at the base of the neck. 13 points, C6. All the way. Easy.
Relax it on. Deep breath chest put on.
C6. C6. Good. Aram se. Gotcha. Hi, madam. Bashi, bashi.
What does that mean?
Soft, just you know.
Okay,
Like I teach my kids bashi, bashi. Soft. Soft, soft. Sit up straight, please. Okay, can you walk for us? Now it's easier to get up. Now it's a little bit easier, right?
Because when I try to hasta ahí llego. That's all the way she goes. Like it hurts to do like even like a little bit up or down. All my life I do places. Weight.
Okay.
Exercise with weight.
Yes.
And when I try to make breast or a shoulder,
Yeah.
I feel this.
Okay.
the
Right
shoulder.
now, when you put your arms up, is it different from when we started, or same?
It's different, but
But you still feel
yes.
it.
Okay.
So we're gonna go a little deeper today, okay?
Okay.
Today we're gonna be working on your C7. We're gonna continue. You ready?
Yeah.
All right. We're gonna be right there. Nice and easy there. Let's get the power onto the shoulder. Bueno. Bueno. Good. There it is. Look up. Gotcha. Nice. Mira, do a shoulder press. Mejor. Do it. That's it.
Yes.
Do it. There's
It's
nothing.
incredible. She wants to cry now. Wow. Yes, of course.
Brian, welcome to the office.
Thank you.
Nice to meet you.
Nice to meet you too. I mean, you'll find some stuff in the neck. I was in a jet ski accident, 2017, I was knocked unconscious, tossed in the water, and I had a lot of like kind of dizziness, like lightheaded stuff. That's actually what had me take the spill down the stairs. I got like a woozy thing and like lost my equilibrium and went. I was getting a lot of like kind of pins and needles down the left side after that, but that's largely gone. There's still a spot right about, if I find the right spot, like if I just touch my own pressure, it's like electricity.
You feel it, yeah?
Yeah, like a pinched nerve probably or something.
Yeah, okay. We'll take a look at it. Oh, here's the other piece of the puzzle. There's your neutral neck.
Yeah.
Your neck curve is actually decent, dude. Your discs are great. This one is a tiny bit less, yes?
Yeah.
And there's a little bit of traction osteophyte on the back, so that tells me.
That's probably that electric spot.
Mhm.
Yeah.
And that's when you rub it or you push it, you said?
Yep.
Extension is when you feel it more because it pinches in the back there.
Mm-hmm.
And now, but that's not the answer for the fix. Here's the answer. These all move forward, right? That one didn't move, correct? But neither did that. So same thing, either 6, but maybe even 7.
Yeah.
5 is a result. 3, 4, 5 keeps the diaphragm alive. So 5, this could be a compensation that's been there a while that's affecting.
Yeah.
Okay. Starting at the base of the neck. Oh, it's just 20 points.
It's a lot.
Yeah, it's a lot.
To the left, right?
Yes. So you want to know the interesting part?
Yeah.
Interesting.
Yeah.
Interesting. C6 is wedged on the right, C5 is wedged on the left. You're feeling C5, but it's C6.
This is the up here. Right?
No, this is here.
Okay.
So you know how you're feeling that pinch there?
Oh yeah.
But the wedge, 6 is wedged on the right, 5 is wedged on the left.
Uh-huh.
I'm going to set 6 on the right first.
Okay.
And then we'll see. Okay?
Yep.
C6. Da-da-da-da. Da-da-da-da. Nice and easy there. You crack your own neck a lot. Firm.
Oh! I heard that one.
Really?
Yeah.
Did you hear something? I didn't hear anything. Bend to the
Must have been
right.
one of those poppets.
Bend to the left. Let's get a little bit more. Mm-hmm.
Oh! That was it.
That was it.
Oh, that was it. I feel like cold liquid is coming out of my right ear. Warm liquid.
Deep breath. All right, style, brother.
Yeah, what's happening there? I'm super curious.
Oh my God, it was 20.
Yeah.
Tell him, camera person.
It's clear.
What?
It's clear.
Oh, wow.
What?
Clear.
Clear. Neck is clear.
I'm waiting for the famous line.
Welcome to the office.
Thank you. Appreciate it.
You got it.